Hi everyone, and welcome to TS Fibro, or welcome back to TS Fibro. I hope you're enjoying my channel. If you have any suggestions or any particular symptom that you would like researched, just give me a message and down below at the bottom. Just send me a message and I'll see what I can do. Today's video is number 8, an introduction to fibromyalgia, which is the video that's pretty close to the very bottom of the videos, and it is tummy troubles with fibromyalgia. One of them is irritable bowel syndrome. Irritable bowel syndrome affects 25 to 55 million Americans every year, characterized by abdominal cramping, bloating, and changes in bowel functions. IBS is a very uncomfortable condition which can interfere with all aspects of life. Fibromyalgia is often associated with IBS, irritable bowel syndrome, and anywhere between 30% and 70% of fibromyalgia sufferers will have to battle with this illness. In fact, more and more research indicates that the causes of fibromyalgia and IBS are similar, and perhaps even identical. What is irritable bowel syndrome? IBS is a condition that affects the large intestine, commonly called the bowel. It is characterized by an extreme sensitivity to muscle contractions in the large intestine, which can cause symptoms including diarrhea and constipation. Like fibromyalgia, IBS is classified as a functional disorder because there is no clear structural or chemical cause for the condition. IBS is thought to affect as many as 70% of fibromyalgia sufferers. It tends to affect women more than men. Although large numbers of men, women, and children are affected by the syndrome. Generally, women are 3 times more likely to develop IBS. People with both fibromyalgia and IBS tend to suffer from more severe symptoms than those with only one of the syndromes. If you have IBS and fibromyalgia symptoms, it is important that you find a treatment that can address both syndromes. Onset of irritable bowel syndrome. Like fibromyalgia, IBS tends to occur after a particularly traumatic or stressful life event. IBS may begin after an illness, a move, or beginning a new job. Much like fibromyalgia, stress is one of the larger causes of irritable bowel syndrome symptoms. Stress exacerbates contractions, diarrhea, constipation, and flatulence. Other triggers include specific foods, especially chocolate, milk products, and alcohol, certainly smells, and certain medications. IBS is not a very nice illness to have. Depending upon its severity, IBS can really impact your day-to-day life, making it impossible to attend social functions, go to work or school, or even travel short distances away from home. If you have IBS, you will probably experience all 3 of these symptoms: abdominal pain relieved by bowel movements, change in the frequency of bowel movements, change in the look of bowel movements. IBS is a chronic illness that tends to get worse over time or is exacerbated by certain foods or medicines. If you suffer from IBS, you should also keep a record of the foods that you have been eating as well as your symptoms. If you have IBS, you may suffer from some or all of the following symptoms: moderate to severe abdominal cramping, bloating after eating, flatulence, nausea, lack of appetite, very loose or watery stools, very hard pebble-like stools, stools covered in stringy mucus, more than 3 bowel movements every day, extreme urgency, or fecal incontinence. The causes of IBS are still unknown. However, recent research does show that IBS syndrome may be caused by a problem with neurotransmitters in the brain, much like fibromyalgia. Similar to fibromyalgia, IBS is often thought of as an illness caused by psychological reasons such as stress. However, new studies show that psychological factors may not be the only ones at play in causing the illness. In order to rid your body of excess wastes, your intestines contract, pushing stool out of your body. People with IBS seem to have an overactive bowel that continually contracts. This contraction, causes the cramping, bloating, and bowel difficulties associated with the illness. It is thought that people with IBS have an extra sensitivity to pain and contractions that occur in their gastrointestinal tract. This is very similar to people with fibromyalgia who have an extreme sensitivity to pain in their muscles and skin. It has been theorized that both disorders are caused by problems with the brain ability to process pain signals. However, the brain interprets pain signals as much more intense than they really are, resulting in severe discomfort and sometimes even disability. For people suffering from both fibromyalgia and IBS, it is important to understand how the two illnesses can impact upon each other. As many as 70% of fibromyalgia sufferers have IBS. Similarly, 1 in 5 IBS sufferers have fibromyalgia. Dealing with both illnesses at the same time can be very difficult because the symptoms tend to be much more severe. Recent studies have shown that people who have both IBS and fibromyalgia suffer from symptoms that are 38% more severe than those who only have one illness. IBS tends to exacerbate fibromyalgia pain and fatigue, while fibromyalgia tends to increase the severity and frequency of IBS symptoms. Studies also show that people with both illnesses tend to have a worse quality of life than those with only one. This is because of the limitations that the disease can put on your daily lifestyle. Self-treatment options often prove very helpful to those who are suffering from mild forms of irritable bowel syndrome. An easy way to find some relief from your symptoms, including constipation, diarrhea, and gas, is through simple changes to your diet. Keep a diary of the foods that you eat and any symptoms that occur afterwards. If you notice that certain foods are triggering your symptoms, try to reduce or eliminate them. For those suffering from constipation, try to increase the amount of fiber in your diet by eating more whole grain foods. Try drinking 8 to 10 glasses of water every day to help ease both constipation and diarrhea. Stress and anxiety often exacerbate symptoms of irritable bowel syndrome. This is because receptors in your brain are directly connected to nerves in your gastrointestinal tract. Aim to reduce stress by getting proper sleep, engaging in daily exercise, and by getting counseling for your emotional needs. Laxatives and stool softeners are often the first-line approach to treating constipation caused by irritable bowel syndrome. Over-the-counter drugs like Colace help water mix with waste, thus softening stools. These laxatives should not be taken for extended periods, though, because they can cause dependence. If you suffer from diarrhea, then you may want to try antidiarrheals or antispasmodic medications. Antidiarrheals help to alleviate the pain of cramping caused by diarrhea. Imodium, an over-the-counter drug, is very effective at slowing the action of the bowel, thus reducing diarrhea. Antispasmodic prescription drugs work to relieve diarrhea by relaxing muscles in the wall of your gut. They also reduce contractions and cramping caused by diarrhea. A popular antispasmodic for irritable bowel syndrome is dicyclomine, sold under the name brand of Bentyl. Bentyl is associated with side effects including dry mouth, dizziness, blurred vision, and nausea. Before you take anything, please consult your doctor. Always consult your doctor first. Here we go again. So many symptoms associated with fibromyalgia syndrome are similar to the symptoms of other illnesses that making a clear diagnosis is often very difficult. Such is the case with irritable bowel syndrome and inflammatory bowel disease, which is IBD, which includes Crohn's disease and ulcerative colitis. All conditions have many symptoms in common, although they are distinctly different issues. IBS is not IBD. IBS is a syndrome, meaning that it is a collection of symptoms that indicate a particular disorder or condition. IBD, either Crohn's or colitis, are diseases that include bleeding and that can put patients at risk for colon cancer. The treatments vary greatly for IBS and IBD, and if the wrong protocols are used for one or the other, the end results can be ineffective or worse, dangerous. There are a number of theories as to why fibromyalgia is common among those with Crohn's and ulcerative colitis. I don't know why that word is so hard for me to get. One such theory is that because the onset and progression of symptoms for both conditions often occur at the same time, it may be that they have a common cause, that being excess pro-inflammatory cytokine activation. In a study done in 2009 at the Department of Gastroenterology, University Hospital, in 25% of people with IBD, musculoskeletal symptoms developed, the most common of which are arthritis and fibromyalgia. The symptoms happen either before or at the same time as IBD, not afterward, indicating that whatever caused the IBD could be accountable for the other conditions. Symptoms of IBD and other conditions manifest and move parallel to one another. Successful treatment of IBD often results in remission of musculoskeletal symptoms. The bottom line of the study, and what appears to be consistent in dealing with IBD and fibromyalgia, is that controlling intestinal inflammation is a cornerstone therapeutic approach for the treatment of fibromyalgia. Here's what some women shared about their IBS. 1. Any stress I have normally shows as violent stomach cramps and diarrhea, especially when I have high pain days. 2. Getting stuck in the bathroom for an embarrassing amount of time. Third person. My stomach produces too much acid. The pain is horrible. I am getting my gallbladder checked. This has been going on since last summer. This is another person. My doctor said that fibromyalgia and IBS with diarrhea tend to go hand in hand. It can be quite debilitating, especially when I'm on the downswing of my fibromyalgia, because it makes the IBS with diarrhea so much worse. The fifth person said, IBS, food intolerances. I'm more pooey and gassy. Oh, bloated stomach. Another person said, I get stabbing pains in my abdominal area for no apparent reason. It's random and severe and never in the same place, so I can only imagine it's something upsetting my gastrointestinal tract. Another one said, I never know if eating will set off my IBS or not. It's a guessing game I wish I didn't have to play. Another one said, IBS with both constipation and the other end of the spectrum. I also get so bloated that I can't wear pants sometimes. When I tell people, they try to fix it with, well, have you tried changing anything lately? Or have you tried this? Or have you tried that? But I know it's just a matter of waiting out the flare-up. Another one said, I have IBS ulcers, Barrett's esophagus bloating trapped gas. Another one says, almost constant nausea, and suddenly I have severe diarrhea and vomiting around my menstrual cycle. Another woman says, for a few months, close to 6 months, I didn't eat almost at all. I drank a lot of stuff. The thought of chewing made me nauseous, and my stomach could only handle drinks, basically. I can feel it trying to start again. It is the worst. Another woman said food sensitivities and intolerance. Another one said bloating, which looks and feels more like ballooning. I keep 2 sizes of clothes. My stomach dictates my fashion for the day. Add the gas, lots of it. I do mindful eating for my health and comfort. Another one says, IBS has to be one of the worst symptoms of fibromyalgia. I went for months on end with constant stomach upsets. It settled down, but somehow the waiting and wondering when it's coming back is almost as bad as the flare. It's painful, it's embarrassing, and not being able to stray far from a toilet during a flare makes an already isolated illness that much lonelier. Another one says, IBS. One day I can't go, and the next day I can't stop going. Another one said, wicked acid reflux. And another one, bouts of chronic diarrhea, especially in this heat, which then leads to increased pain that wraps itself around my middle. Another one, what don't I have? I feel like the Pepto Bismol jingle. Heartburn, nausea, indigestion, upset stomach, diarrhea. Yay, Pepto Bismol. Ugh. My IBS, it can get so bad. It's the cramping, it's the nausea. I can be on the floor in the bathroom for hours on end. I'm on the toilet, I'm on the floor because I feel like I'm going to pass out sometimes. I have to have a fan blowing on me. I get so hot and I start sweating profusely. So if I don't have a fan, it seems to get a lot worse. If I have a fan, it's still really, really bad, but it's not as bad as if I don't have a fan. I want to get on the cool tiles, but it's awful not knowing when it's going to hit, how hard it's going to hit. And I can start out with being so constipated, and by the end of the symptom that I'm having at that particular time, it'll end up with total diarrhea. It's awful. What are some of your symptoms if you have IBS constipation, or if you have IBS diarrhea, or if you have a combination of both? If you would like to, you can email me your symptoms because I would love to include them in some of my videos. I won't say your name. Just so people out there that may not have symptoms that they've heard on here, that you have symptoms that they may have, and they can connect with you. So you can email me at tsfibro@aol.com, and we can help other people with your symptoms, because when you hear someone that has the same symptoms, you know they understand. And if you have fibromyalgia and IBS, then of course you understand. But some of ours is more severe than others. But anyway, thank you everybody for joining me in this video with fibromyalgia and stomach problems. If you haven't already, please subscribe. Just hit that red subscribe button underneath the video here, and then a little bell will pop up. Click on the bell and hit notifications so you'll be notified of the next video I release. And if you don't mind, if you like the video, please hit that thumbs up for me. I would appreciate it. I pray for a cure, and I pray you have a pain-free day. God bless everyone.